Okay, welcome everybody to the Human Services and Community Safety Committee meeting. It's important to understand that no formal votes or decisions about city programs, policies, or budgets will happen here. Our role is to explore various topics with staff and stakeholders and community members and to make recommendations to our council colleagues. We want this process to be transparent, inclusive, and easy for you to be a part of whenever you choose to be. And you can share your thoughts with us by filling out a comment card about any item on the meeting agenda or by reaching out to us directly with any other thoughts, questions, or ideas. We need you to fill out a comment card in advance that will be read into the record for any agendized item. The link to the comment cards can be found on our committee webpage and at www.tempe.gov/HSCS. And you will also find contact information for committee members and staff there for non-agendized questions as well. So item number 1, I'll call this meeting to order on May 15th. This is the meeting of the Human Services and Community Safety Committee meeting. Joel Navarro, you are up for number 2.
I'm just having some technical difficulties. If you could read item number 2 for me.
Absolutely. I'm just going to make a motion to approve the April 10th, 2024 meeting minutes. I make the motion. Would you like to second?
Second.
All right. All in favor? Aye. There's just 2 of us, so here we go. On to item number 3, public comments. The committee welcomes public comment according to the Arizona Open Meeting Law, and the committee may only discuss matters listed on the agenda. Matters brought up by the public under public appearances that are not listed on the agenda cannot be discussed by the committee. We have 30 minutes allotted for public comments with up to 2 minutes per speaker. Speakers will be called in the order of their comment cards as they were received. Any comments not presented today will be entered into the public record. And do we have any comment cards? No, no comments or comment cards. All right, the next item on the agenda then is the committee session items. Committee session item, the first one that we have is Community Supervision Program Update and Client Awards Recognition, presented by Deputy Human Services Director Paul Bentley and Human Services Manager Diana Caldralos. I said that wrong. Welcome, both of you.
Paul, the clicker's right there for you.
Thank you.
Thank you for this opportunity and good afternoon. Very grateful of Councilmember Garland and Navarro of providing us an opportunity to celebrate some of the great successes within our programs today and also provide some updates of our programs themselves. So again, I'm Paul Bentley, Deputy Community Health and Human Services Director here for the City of Tempe. With me is Diana Calandros, our Manager over Community Supervision and Counseling Services, and we're really looking forward to share the information today. Our agenda is going to begin with just that connectivity of our work and the work that's being done here with our council priorities. And then from there, moving into our program updates. And there's some exciting new updates that Diana's going to share specifically to a new grant opportunity that was awarded with a partnership with La Frontera Impact, as well as updates with our incentives programs and other specific areas in which we appreciate the opportunity to communicate how we are ensuring that we're providing quality service to those that we serve within community supervision. And then from there, we will talk a little bit more specifically about our incentives program, which was instituted over a year ago and has had great success as well as great interest from others within the state and across the nation as far as how we are implementing a program that further promotes the well-being of individuals by also including accountability together in that. And then move into our client recognition, understanding that with scheduling that we're going to have some folks here on behalf of our clients, but absolutely taking this opportunity to recognize folks that have worked very hard in our programs to ensure that they are also learning and growing in an environment in which we need everyone in the community to be able to do so. So with that, I'm going to hand it over to Diana, and thank you again for this opportunity.
Good afternoon. Thank you so much, Paul, for that introduction. So we're going to start with council priorities, and these are the ones that are essential to our community supervision program. And this is our mission statement. And we want to positively resolve offenses through education, consequences, and treatment. We work collaboratively with the court and the city prosecutor's office and other agencies within the city of Tempe to connect our participants to support to help them succeed. So our community supervision programs are supervised probation, a Title IX deferred prosecution, making improvements permanent, which is our alcohol for our under 21 offenses, community diversion, adult and youth diversion, the East Valley Regional Veterans Court, and home detention. So one of the things we did want to highlight, as Paul mentioned, is that community supervision was recently awarded a $25,000 grant from the Veterans Services Fund and through the Arizona Department of Veterans Services. This allows us to partner with La Frontera Impact to provide the evidence-based Strength at Home program to the East Valley Regional Veteran Court participants, as well as other community supervision clients. This is a program that was prior to now unavailable to our clients. So this grant is allowing us to provide this program and to provide it with no cost to the clients. We wanted to highlight home detention for our fiscal year 23. I think home detention is one of our unsung programs because people can continue to work, pay taxes, attend school, continue to provide child, elder, or pet care that is not interrupted. Medication expenses for our in-custody and returning court hearings are not part of this cost savings that I'm showing you here. This is simply the jail bed days, and we have saved, with 433 successful completions, over $780,000. So our caseloads, as we progress with community supervision, we see lots of folks, and it's generally averaging about 800 a month. And with that, with some efficiencies that were implemented by working with a full staff and working with some new intake procedures, that the intakes that are scheduled for folks referred by the court have actually decreased in wait times by 83%. So we're able to get folks in for an intake close to 2 weeks, sometimes even within the same week, in order to get this process started. This allows staff to dedicate more time to clients for identification and assistance in facilitating needs and referrals to appropriate programs. So our incentives program is something that, as Paul mentioned, we started over a year ago. It started September 2021, and we're going to exchange our monthly fees for participation in additional classes, community service, career development options or opportunities, personal improvement, which can include a variety of things, and sobriety and mental health. This is supported by research into criminogenic attitudes, values, beliefs, and behaviors that are identified, and these methods are encouraged to target these with pro-social and protective factors. Through the incentives program, we encourage activities that directly address identified risks and replace with pro-social activities. And with the incentives program, we have replaced the inability to pay as the reason many people would not be able to successfully complete their community supervision. By replacing this financial burden with pro-social activities, we have increased our successful completions in both supervised probation and our Title IX deferred prosecution. When somebody successfully completes the deferred prosecution program, all of their criminal charges are dismissed. So the outcomes for this is it increased engagement in pro-social pursuits, which is a known protective factor against criminal recidivism. It avoids trapping lower-income community supervision clients in a never-ending loop of debt, failure to pay, and non-compliance, resulting from unpaid community supervision fees. This increases equity for everyone. It also reduces the cost to the city in 3 ways: through the value of community service performed, by saving the cost of reprocessing cases for these unpaid fees, and also a reduction in criminal recidivism. So this is an update, and from October 2023 to April 2024, this is the number of our main focus of the incentives activities that have been completed. So 13 of our clients have completed Triple P. Triple P is a evidence-based parenting program that's based on emotional regulation. It's very intense. It's between 12 to 14 sessions. And we've had 13 people successfully complete that. We've also had 165 parenting classes taken. We've had 492 financial literacy classes. We have 162 hours of community service performed. We have 543 people that have submitted job applications or have had interviews, and 22 out of those were newly hired. They got jobs during this time. 186 12-step meetings were attended. We had 134 mental health sessions that were outside of the requirements. This was in addition to the community service supervision requirements. And then we had 76 college or career courses participated in. And financially, we are on track. This is fiscal year 2024, the first 3 quarters, and it's looking pretty good for us, even with the incentives program. And then we have our client recognition. And as Paul mentioned, unfortunately, we're going to have some staff. Unfortunately, our clients couldn't attend, so we're going to have our staff accept the awards on their behalf. And I am going to read a little information about our clients. Some of this was presented to us by the clients, some of it was presented by our staff. And the first recognition is for Felicia Boz. Ms. Boz was sentenced to supervised probation on 11/23/2022. Despite numerous personal and financial struggles at the beginning of probation, she's persevered and made tremendous strides in changing her life. She enrolled in college in July of 23, and I'm happy to announce she has officially earned the title of medical assistant. Ms. Boz completed all of her required courses, including pharmacology, infection control, anatomy, and physiology, just to name a few. She successfully completed her externship while maintaining a 3.54 GPA. Ms. Boz has also completed her required probation classes on top of her already busy school schedule. We're incredibly proud of her success and everything she has accomplished within her time with community supervision. And accepting this award on behalf of Ms. Boz is Natalie Jimenez, who was the one who shepherded her through this process. And our second recognition goes to Casey Dietz. Casey wrote his own part of this, so I'm going to read it his words, and he has accepted that this is what he wanted to say, and it's pretty powerful. Casey says, "When I started this program, I was in an abusive living situation. I was having a difficult time finding my career path and staying at a job. He was struggling with his mental health. I was so scared when starting the program and honestly thought it would just be something when I have to buckle down and push through for the mandatory amount of sessions. After my initial intake with Amanda, I already felt a different way about the situation. Amanda was the first person that made me feel heard and validated about my situation, as well as showed that someone cared. She set up my counseling sessions with Lexi and made sure I knew I could reach out whenever I had questions or needed support. Upon starting counseling with Lexi, I immediately felt welcome, supported, and cared for. Lexi truly went above and beyond from day one. She gave me the tools to build my confidence, organize my thoughts, and to be able to start making clear and healthy decisions. Above all, she not only helped me while I was in the program and receiving weekly counseling, she gave me the tools and resources to go far beyond when I completed. Since then, I have been able to use these tools and resources every single day. Since completing the program, I have moved to a safe and healthy living situation. I've started a job. I absolutely love it. I've unexpectedly received a huge raise and being mentored towards a career in the insurance industry. I even got to buy a new car. While these may seem like normal life advances, I am in a way better place than I ever could have been before starting this program. For the first time in years, I truly look forward to getting out of bed in the morning and starting my day. The program was genuinely life-changing for me, as I'm sure it has been for many others. If there is anything I can do in the future to advocate for this, I will gladly do my best." And to accept Casey's recognition is Amanda Chavez. And our third person is Javon Ehlers. Javon came to us on the deferred prosecution agreement. While in community supervision, Javon worked hard to complete his requirements and completed extra community service hours. in addition to what he was able to apply, in addition to what he had, and was able to apply this to his outstanding balance using the incentives program. Javon also completed his GED while under community supervision. The GED test is very difficult and requires a lot of studying and practice tests. And Javon is also the very first person to use the GED as an incentive. We want to congratulate Javon on his success and in obtaining his GED. And to accept his award is Sabrina Nelson. And the last person we want to recognize is Ms. Kayla Porterfield. Ms. Kayla has done so much, and we were given an opportunity and a gift to work with Ms. Porterfield. Vanetta recognized she needed support and encouragement way beyond our normal community supervision client. She needed this in order to grow and improve as a person, a parent, and as a member of society. Kayla took this gift and embraced this opportunity. She completed Triple P, worked on her own personal growth, all while completing cosmetology school. She also recently passed the licensing exam and is now a licensed cosmetologist in practice. Ms. Porterfield has achieved so much in the short time we have worked with her. This recognition is so very richly deserved. And to accept her award is Vanetta Lanier. Thank you again for this opportunity to recognize our clients.
Thank you. Those stories last time and this time they're so moving to listen to what people are able to accomplish when you give them an opportunity with something positive to make a change in their life. So I just commend you and all of you that work with them, the wonderful things that you guys do in your department. Thank you so very much. You are changing lives for the better and giving people an opportunity. And I think that's absolutely wonderful. I didn't realize you guys had 800 meetings or appointments a month. Is that what that was? That's amazing.
800 clients in community
800 clients.
supervision.
That's incredible. But thank you again so much. Thank you for the presentation. And I love what you all do. But Diana, thank you.
Thank you so
That's
much.
great. Yay. All right, thank you so much. So we're going to go ahead and move on to our item number 2. And it's an opioid crisis, Tempe Innovation Solutions, OCTIS. We're going to get an update presented by Strategic Initiatives Manager Mary Measy. I hope I say that right. And Community Health and Human Services Director Tim Burge.
Good afternoon, council members. Again, Tim Burge, Director of Community Health and Human Services, and Mary Measy. I'm joined aside. Seated here today, Strategic Initiatives Manager for our SMEO group, who has done a lot of work. So I want to publicly thank her and her whole team for getting us across the finish line to be here before you today. I also want to thank all the members of the OCTIS team. This is truly a multidisciplinary team, as you'll see reflected. A lot of work has gone into getting us to this point for this year. I want to talk to you today about the opioid settlement planning. I want to talk to you about our recommended strategy focus areas, and then kind of foreshadow some next steps in regard to comprehensive strategic planning we'd like to bring back to you in the fall. I'll hand it over to Mary. Sorry, take her slide.
So our work to address this issue is aligned with our City Council priority area, safe and secure communities. It's also aligned with your council committee work plan. And we have 2 specific performance measures that align with this work. First, our performance measure 1.31, addressing opioids. So as a city, we're looking at our EMS calls that are related to opioid misuse. And then we have another performance measure 1.21, specifically looking at youth, alcohol, marijuana, and specifically opioid misuse. So again, trying to address opioid misuse with the youngest of our residents. So it's a pleasure to provide an update on the work of our OCTIS group. The last time we had a presentation to this committee was in June of 2023. So in the past year, our team has been collaboratively meeting not only internally with the core team that you see listed here, but also engaging several key external community members, and really looking at how can we be solution oriented. So we've been looking at how can we really connect the current work that we're doing already in Tempe, looking at ways that we can expand and build upon those strategies, and then just as importantly, how can we address current and emerging needs. So our team has been focused on 3 key strategic directions: prevention, intervention, and enforcement. So members of our core team are currently working on implementing strategies in these 3 areas, and they also serve as our subject matter expertise in these 3 areas. And so we're excited to share the work that we've been bringing forward. We've got some great recommendations based on those conversations that we've had so far this year.
Okay, before we get into the recommendations, I just want to give a little bit of historical walkthrough as to how we got here. I think everybody in the room, and certainly at the dais, is well aware of the national opioid crisis. Back in the early 2020s, an effort by states and municipalities to begin looking at legal action against the producers and distributors of those opioids begin to take root. National opioid settlements have currently accounted for about $50 billion across 10 settlements, looking at about an 18-year distribution pattern that began in 2021. Arizona One agreement was signed on to by Mayor Corey Woods on behalf of the council in March of 2022, and the Arizona share of that national allotment is $1.14 billion. That money flows down from the federal opioid settlement trust to the state, then through Maricopa Department of Public Health, who has an internal direct allotment they use for programming, and then there's passed through to local jurisdictions. Each jurisdiction had to make the choice if they wanted to be able to accept those funds and do programming or have Maricopa County act on their behalf. Tempe stepped forward and said we would like those funds to come to our community so we can do what we do best, and that is provide innovative solutions for our residents. The share was based on a pro rata share of both addiction data as well as population at the time of the lawsuits. So Tempe gets 3.27% of that county allotment. $9.2 million is our projected award over an 18-year period. Sounds like a lot of money when you set it on the table like that, when you recognize over 18 years, that's roughly $500,000 a year to address an ever-increasing amount of issues that we see on our streets with fentanyl-related opioid-laced overdoses on the increase across the nation, and certainly in our community. So what we've begun to do is look at how then do we take this investment and bring to you all recommendations for the maximize the return on investment of these funds into items allowed by the National Trust as well as the One Arizona Agreement, and that's what we'd like to be able to present to you today. So building the plan was not done in a silo. I did mention that allotments began to flow in late 22, early 23, but we've spent this year planning and waiting on a lot of data, starting at 12 o'clock and kind of working around the clock there. One of our first steps was actively participating in the Maricopa Department of Public Health Health Fellow Program. So a public thanks to Jihan, who's been on with the city of Tempe here for 2 years, 1 year embedded over at Tempe Fire, and then last year embedded with Community Health and Human Services, and has also taken on a dual role and helped us interact and build a bridge with the Phoenix Public Health Advisor Program so that we can begin to build bridges there. The Maricopa Department of Public Health did a provider's needs assessment. We had every department that touches overdoses and opioids in the city responded, as well as a large majority of our community nonprofits. That assessment also did not just stop with what the nonprofits and service providers thought about the situation. Maricopa Public Health went out with a consultant and actually did field-based interviews of several hundred persons who use drugs. So we could see from the acronym PUD, we could see from their standpoint why, the when, the where, the on-ramps and off-ramps to their cycles of addiction, and understand the world from their point of view. So we always have their voice at the table when we're doing this planning. Likewise, youth voice is very important, and thank you for the Tempe Coalition, who got a 100% participation rate from all of our high schools to inform the 2022 Arizona Youth Survey data. That has played a key role in informing this process as well. I'm our public health fellow, as well as a lot of staff across the city also helped lend into a resource inventory to understand what we are currently doing as a city, what's happening in our jurisdiction with our nonprofit partners, and what's on the horizon. The key was to understand what's around, what's available, so we're not duplicating services, instead looking to strengthen. Key informant interviews were done as well, making sure that those closest to the decision-making were understood as well. And then opioid-specific data. Maricopa Public Health gives us data specific to our region and our area. And thank you to Tempe Police and Tempe Fire for also bringing very targeted data about Tempe, as well as SMEO group and our wastewater testing. That information is reviewed at our OCTUS meetings and help really inform what approaches they're allowed, would we want to then make recommendations around. But we didn't just stop with the internal team, as well as our OCTUS members. In the spirit of Tempe and bringing voices to the table, these subgroups, prevention, intervention, and enforcement, broke out and invited people to the table to be a part of the planning process. We laid out in that process all of the available options from the National Trust and the Arizona Agreement. I said, what's Tempe need? And we went through that sorting and sifting process to get to the recommendations we'll make. But I want to thank Arizona State University, Kyrene School District, La Frontera, Arizona Impact, in addition to our public health partners at Maricopa, Pathway, Tempe Union, Tempe Elementary School Districts, City Attorney's Office, prosecutors were at the table. And again, important to have all points of view there in the space. In addition to Tempe Fire Medical, Tempe Police, Health and Human Services, our Community Services Department, because our library and our rec centers are also places where overdoses happen. And just again, really thankful for the effort that everyone invested and the time into making this a thoughtful plan. So that brings us to our recommended areas of focus. Again, out of several hundred options on the table, things really began to bubble up into these four categories: prevention, recovery and resiliency, harm reduction, and capacity building. So in our prevention, everyone is concerned about the increasing number of overdoses for our school-aged children. We, through the Tempe Community Coalition and TCC, there's been some education campaigns with the Attorney General in the Maricopa County Attorney's Office, and we've heard tales of young people as young as 4th grade overdosing on what they thought was Skittles brought to a playground and shared at lunchtime. Those things are frightening, but real. Of the 180 overdoses for young people under the age of 18, it does not account for the lion's share, but it is an increasing problem and one that needs to be addressed so that we can stop that pipeline for our young folks. So school-based programs got a lot of focus and attention. Community education campaigns, as well as trauma-informed care. In these education campaigns, it's not just here's what fentanyl or opioids do to you. It's a lot of stigma reduction and making sure that folks understand that there is, for example, a Good Samaritan law in Arizona. If you're with a partner or a co-user and that person is overdosing, you do not have to fear arrest and imprisonment to make that life-saving 911 call. And we want you to make that call and get the help. And again, be exposed to things like our Narcan Leave Behind programs that our fire and PD are doing that would help reduce those potential overdoses in the future as well. Our recovery and resiliency stack looks at peer support. What we know and we've seen in our own homeless outreach programs is that individuals with lived experience help speak into making real change happen more quickly. So support best practice peer support programs. Mobile services go to where the people are. Again, as evidenced by our Care 7 and Hope team success is something we can certainly build upon, and as well as population and specific need-focused individuals. And those populations include individuals who have co-occurring disorders, meaning they're abused, addicted to substances, as well as have a co-occurring mental health issue, as well as individuals who are justice involved. You heard a great presentation about what investing in individuals who have justice involvement can do by way of life change, wanting to look to further those programs and processes. And again, young people, making sure that they don't face a lifetime of addiction. Harm reduction. I know I'm going to pause here for a moment because I know that those two words can cause a reaction for folks. I want to be very specific. There's multi-prongs in a harm reduction plan, and what bubbled up through our informed planning for Tempe was naloxone distribution. So Narcan leave behind programs, which are already happening, the Narcan education programs, the Narcan distribution, and the TCC has been doing, the Narcan training of school staff that the Tempe Coalition has already been doing, furthering and strengthening those types of approaches. Stigma reducing initiatives, I mentioned public ad campaigns. Some of these things you'll see crosshatched in a couple of these stacks, which means that those are good investments for us to make, and Good Samaritan education. Capacity building is really important. These monies have to be accounted for in a very particular way. Any program funded has to be tracked, each dollar has to be tracked back to the particular settlement and the particular distribution. So there's a lot of paperwork and reporting and oversight through the State Attorney General's office that has to be maintained. And we want to make sure that any dollars we put out in the streets or infused into our partners is well tracked. And we want to be able to come back and report outcomes to you. So capacity building through administration and operations, but not just on the community health and human services side. It's important for us to note that there is a call out in the plan that these dollars can be used to support operations for first responders. So that means our fire and our PD department, as they look for prevention, intervention, and enforcement efforts of their own. These dollars can be used to infuse and support those efforts as well. Of course, a lot of data and reporting. We make data-informed decisions here, so we want to make sure that our dashboard that we already have up, I know Phoenix recently got a lot of pub around theirs, but Tempe's had ours up and out there, and we want to continue to expand and support and improve that. And give it some longevity and sustainability, as well as training. And that training is not just for community members, that's also for our staff inside of community health and human services across the entire of the Tempe employment base, making sure that everyone knows that addiction knows no socioeconomic or racial boundaries. It impacts everybody that we live next to, everyone that we call family, neighbors, or coworkers. And so we want to make sure that everybody is informed about signs and intervention strategies, as well as they understand that they can go to Walgreens and pick up Narcan today and have it in their house for their own use if they don't have access to it for free through one of our other programs. So this is our investment strategy, a recommendation for our focus areas that have come out of this year of planning around these opioid funds. You'll see this built on the bedrock of stakeholder engagement and community partnerships. This is just a small sliver, though, of the overall approaches of things being done to address the opioid and addiction crisis in Tempe and in the East Valley. We will be certainly coming back to you with a more comprehensive strategic plan that includes everything from the focused capture and enforcement efforts that PD is doing, down to our partners and programs of post-overdose support teams that PD is doing with our friends over at La Frontera Impact, bringing all those strategies back to you in a bigger document in the fall. But because we are in budget season and the transfer of those funds have come to Community Health and Human Services, and we need to be able to offer reporting back to Maricopa Public Health about our planning and our strategies, wanted to bring this before you as a committee and give you a chance to comment, give us your thoughts, your guidance, and let us know what we can answer for you at this point.
I just see, Joel, do you have any questions?
No, thanks, Doreen. No questions, but just more recognition. I mean, this is outstanding, guys. I first want to say, even on the first speakers to the award ceremony, I mean, what great accomplishments we've done within our community, just getting people back on track and productive on their feet again. Same thing with this program. Obviously, we're just trying to get that awareness out. First off, educate, use the partnerships that we already have out there. with PD, fire, and our other resources, third-party resources throughout the community. I think this is a great opportunity. To use that money towards those resources. Granted, when you break it down, just as stated, over the course of those years, you're talking about $500,000 a year. Still needs more support, but it's a great start. What we can do and what we can achieve. I think what we've already done within the schools and continue to do within the schools, trying to get these kids that recognition of education on this deadly drug and what it's doing in our community, getting in with the sixth graders and having the opportunity to educate them so that as they get into that middle school era and high school, they have a better understanding of what not to do and what the outcomes can be. So great presentation, guys. I appreciate what you guys are doing and totally support it.
Thanks, Joel. I wrote down on here that when they were doing the MCDPH assessment, I really liked the fact that they were going out and interviewing people with the use, because so many times we get in a position where we start coming up with ideas and thinking that we can be doing something, but we forget that it's best, instead of talking about somebody, we should be talking to them. And so I'm really glad that they did that. That's one of the things I wrote in my notes. The other one is I appreciate you saying something about the Good Samaritan law, because we don't want people or kids to be thinking that they're going to get in trouble if they call 911 and when the best thing they could have done is at that moment call and saved a life. So I appreciate that. I love the stuff that we're still doing, the Narcan training that the Tempe Coalition is going out and doing that. I think I just heard that there's a training on June 7th that's coming up that anybody can attend. I took the training through Tempe Coalition. I have my Narcan that I have with me that does not sit in the car. You have to have it with you because it can't be at over 80 degrees or something like that. The dashboard that you guys are updating, that's accessible to residents to be able to see that information?
Yep, it's linked through our performancetempe.gov and our Open Tempe website.
Okay, great. I appreciate that. Thank you so much for what you're doing. I cannot wait for the other presentation that you're going to be doing, but thank you so much for being here and sharing this information with us. You guys are doing great work.
Thank you.
Thank you. All right, so the next item is item number 3, and it's the tobacco licensing update presented by Tax and Licensing Manager Josh Bice. I'm sorry, I don't have my glasses on, so I'm trying to read. And Financial Services Director Lisette Camacho, is she? There she is.
Lisette's here, but
Both,
just
got
me
both of you
today.
on.
Yep.
Both of you are on the hook. Thank you for being here.
Good afternoon, Mayor, members of the council. I'll turn over the presentation to Mr. Bice. We have a few slides, and I think we have a pretty good update for you today.
Great, thank you.
Yeah, thank you, Councilmember Garlett and Councilmember Navarro. We were asked to give an update on the tobacco seller's license that did go into an effect on May 1st of 2024. Just reminding everyone again of our council priorities that have been outlined, 121 and 131. We've been over those many times, of course, over the last couple years. So as of yesterday, we had 101 active tobacco seller licenses in our system, which is quite a jump from the last time we gave you an update. And I did check this morning, we actually have 102. One came in last night. So on May 1st, which again was our effective date of the ordinance, we did mail out 42 letters to identified unlicensed sellers and vendors in our city. They were given 30 days to be into compliance, otherwise they would be assessed a $500 violation, a penalty for the first violation of the ordinance. Going forward, one of the requirements of the ordinance, of course, was to obtain certification and training through Arizona Retail Tobacco. And now we do not have any specific Tempe training classes. However, the program or the state does give general classes twice a month for those. So they're able to still obtain that training going forward. Some outreach that we've done, we are individually calling those still unlicensed vendors and retailers. My team is taking that. We have also identified possibly somewhere 6 to 8 retailers that have just closed. So that initial 153 roughly number that we identified of retailers in our city, excuse me, there are some that are actually closed. Police department is actually hand delivering some of our letters that we already mailed out on May 1st, but they're also taking them out to these unlicensed retailers as well, which is going to be very helpful. And going forward, If we have a business that is not licensed by June 1st, which was our 30-day window for the first violation, they will be also assessed that $500 penalty again. And we will be sending out a second violation, a notice of violation on June 1st to, again, all the businesses that are still unlicensed. At that point, they will get 30 additional days. And if they are not into compliance, they will not only get the first violation, but they'll be assessed a second violation. And we can see there the penalty does go up to $750. They are also prohibited from selling tobacco products for 7 days, and they have to pull those off their shelves in their place of business. If we have any questions, there's Tobacco Sellers is our dedicated website.
No, that is great. I was really concerned. I think it was the week before when this was going to kick off on May 1st, that last week of April, when I was asking about the number. I was very concerned because it was such a low number that people were actually have gone in and taken the class and got their license. So I'm happy to see that it's 102. I'll be even happier when we have all of them in there. But thank you so much for the outreach that you're doing. One of the questions I had is, how does somebody know that the business they're going into is actually licensed to sell? Is there a posted license in the window, on the wall? What happens?
Yeah, we do send them a physical certificate, and they are required to post that. In relation somewhat, these businesses are also required to post signage that says they're not allowed to sell to under 21. But yes, they are. The ordinance reads, in a conspicuous place, they are required to display their license.
Okay, because go ahead and list it.
Mayor, Councilmember Garland, we also have a posting online of all the licensed retailers. So we're going to work with IT because the Attorney General's office, they do have a map that they have the retailers, so they have specific dots for them. We're trying to recreate the same thing for our website. But we are up on a weekly basis, we are posting the list of licensed retailers on our website, the tobacco sellers that you're seeing in here.
Okay, great. I mean, I don't want to drive around and check for license, but if I go somewhere and there's not a license up at a Bash's or Circle K, I just want to know what I should be looking for to encourage. I mean, again, we've done, I think, a really great job of trying to encourage by education first. And so I'm really proud of this program. This is a really good step for us to see what we might be doing in the future, but really appreciate it. Thank you so much for what you guys have done so far. Let's just cross our fingers that we get everybody else that'll comply and we don't have to worry about the fees. Councilmember Navarro, do you have any questions?
No, that's just great information. Appreciate you guys. Thank you.
Thank you very much.
All right, thank you very much. All right, so we're gonna move on to item B, where we don't have our next meeting set, so that's where we would announce when our next meeting will be. We don't have that information yet, the date or the time, so we will, it'll be posted on our website. I'm sure if you're interested, you'll be able to find out when that next meeting is. And so right now, we're gonna move on to item number 6, which is adjournment. Thank you so much for everybody for participating.